for our Ask the Doctor segment. And my first guest is a native of Puerto Rico, but she moved to the United States when she was 15 years old. While she was in high school age, she moved to the United States. She graduated from the University of Illinois, Urbana in Champaign. She also got her MD from the University of Illinois, Chicago. Her residency, she also did in Chicago, good theme here, at Mount Sinai Hospital. Dr. Laura has been an OBGYN for 11 years. She is employed by Northwestern Medicine, and she practices at Del Nor Hospital in Geneva, Illinois. She has two great kids, Mario, who is 21, and little Lori, who is 13. She also has a cat named Mittens. I throw that in because I too have a cat that I'm kind of fond of. So please join me in welcoming Dr. Laura Pinheiro.
Hello. Hi.
Well, thank you for being here.
Oh, thank you for inviting me.
Thank you. It's the first segment of our show, so we have many of our viewers who I call Transformers. They are pregnant and they have questions. Some of them might have got pregnant around January, New Year's Day, you know how that goes, or Valentine's Day, which makes them about 5 or 6 months long. So many of them were wondering, one or two things, that either they should stop exercising or should they not exercise at all? Should this not be a function or anything that they do at all? So they sent in their questions to ask the doctor. So let's talk to the expert. And hopefully we can put all of your fears and concerns to rest. So back in the day, women were advised to either stop exercising altogether or to just cut back. But nowadays we see that's completely the opposite of advice that we're given. The American College of Obstetricians and Gynecologists says that being physically active during pregnancy contributes to a better pregnancy term and even shorter labor times. So what are your thoughts about being active while one is pregnant?
I completely agree. It's interesting enough that it was in 2010 that we started seeing those changes. The American College of Obstetricians and Gynecologists published an article that talked about all the different recommendations and the contraindications and how we should counsel our patients as to stay healthy, and they were promoting the health benefits of exercise during pregnancy, which wasn't seen prior to that.
Wow. So that's good. It's always good. They always send out these medical reports and they give us great insight. But then nonetheless, there's always myths that continue to plague fitness and pregnancy and whether or not it should be done. So of course, that leaves a lot of women confused and ill-advised as to what they should be doing physically while they're pregnant to try to maintain good health and fitness during that time. So I have a few statements that I want to pick your brain about, and then you tell me whether or not it's fact or myth and why.
That sounds like fun. Let's do this.
Fact or myth? Pregnancy can make you more prone to certain fitness injuries.
Fact. We know that there are two hormones specifically, estrogen and relaxin, that the body produces while you're pregnant. And these hormones are really good at working with the ligaments, and they relax the ligaments so that when you're in labor and you're about to deliver, the pelvis can open up and provide more room so that the fetus can get through. But what happens with pregnancy itself is that throughout the entire pregnancy, it can also increase the risk of injury to the joints. We know that the ligaments are what usually sustain and protect and support our joints. And if the relaxin relaxes the ligaments, then they're at a higher risk of being more mobile, therefore they can cause injury. In addition to that, with pregnancy, women usually gain a significant amount of weight. Even if they're exercising regularly and eating healthy, we know that women are still going to gain at least 20 to 25 pounds throughout their pregnancy. that increase in abdominal girth actually changes the center of their balance, and it causes them to shift forward a little bit. And that in itself can cause injuries to the knee, to the pelvis, and that's why people complain of pelvic pain, back pain, and sometimes even knee pain as they're carrying the pregnancy through the 9 months.
Or 10 months in my case. And she said 20 pounds, you'll gain about 20 pounds. I gained 60. Yeah.
Well, that's why we recommend if you're eating healthy and you're exercising regularly, we can cut that down and keep it at 25 to 30 pounds.
Yeah, I missed that article. Fact or myth? Not every exercise is safe to do during pregnancy.
Fact. There are some exercises that are kind of dangerous to do while you're pregnant. We talked a little bit about the difficulty with balance and how you can easily fall and cause an injury. So we usually recommend patients to avoid any kind of exercise where they might lose their balance and fall, just because pregnancy itself can increase their risk of falling already. Another thing that we don't recommend is we don't recommend any contact sports, just because we don't want to have any direct abdominal trauma to the abdomen that can cause problems with the pregnancy. Something called an abruption, where if you have an abruption, the placenta can separate and that can cause vaginal bleeding and even fetal death, so it's dangerous. So we usually recommend them to avoid any contact sport. In addition, we also tell patients that we don't recommend scuba diving. And also, if they've moved to a new area where the altitude is greater than 6,000 feet, we recommend that they get accustomed to living in that area first before they start exercising regularly. Just because we know that the oxygenation levels in the red blood cells decreases a little bit in that at that altitude, and it can decrease the oxygen that they're getting through their blood vessels to the baby.
Okay. And so squats and lunges.
Squats and lunges, the reason they're kind of, sometimes people say that you can't do them is just because of the joint issue. If the joints are already relaxed and more at risk of causing an injury, you can do a lunge, but just not too stretched out. And when you do squats, don't go too far down.
Okay.
And the other one is abdominals. You always hear not to do crunches or abdominal exercises when you're pregnant. The reason being is we just don't want you to be in a supine position. We don't want you to be lying down on your back. We know that when you're lying flat on your back, that decreases also the oxygenation because it decreases the blood flow to the placenta, to the baby.
Okay. Well, this has been great. Thank you, Dr. Laura. Please thank Dr. Laura for joining us today. Transformers, remember to talk with your doctor first before starting any exercise program. This can be dangerous, but then it can also be healthy for you. It's a win-win for you and the baby. So please consult your physician first. If you have more questions for myself or for Dr. Laura, please send those in on our Facebook page, DanaSimone Show page, or tweet us at ShowDana on the Twitter account. We'll answer those questions right after the show. In the meantime,